Welcome. In this video, we'll be exploring myotonic dystrophy, a complex and often debilitating form of muscular dystrophy. We'll delve into its causes, how it affects the body, its prevalence, symptoms, diagnosis, and current management strategies. Join us as we unravel the intricacies of this fascinating and challenging condition. Myotonic dystrophy isn't caused by an infection or injury. It's a genetic disorder, meaning it's passed down through families. Specifically, it's caused by an expansion of a repeating segment of DNA within a gene. In myotonic dystrophy type 1, or DM1, the culprit is a CTG repeat expansion in the DMPK gene. In myotonic dystrophy type 2, or DM2, it's a CCTG repeat expansion in the CMBP gene. These expansions are unstable and tend to get larger with each passing generation, leading to earlier onset and more severe symptoms, a phenomenon called anticipation. Now, let's talk about what happens in the body. Those expanded repeats we just mentioned, they disrupt the normal splicing of other genes. Splicing is a crucial process where specific parts of our genes are pieced together to create proteins. When it goes wrong, proteins crucial for muscle and other tissue function are incorrectly produced or absent altogether. In DM1, for example, the altered DMP gene interferes with RNA splicing, impacting numerous cellular functions, particularly in muscle, heart, and brain tissue. This abnormal splicing is what ultimately leads to the characteristic myotonia and other features of the disease. Myotonic dystrophy isn't rare, but it's not extremely common either. DM1 is the most frequent form of adult-onset muscular dystrophy, affecting approximately 1 in 8,000 people worldwide. DM2 is less common than DM1, but it's more prevalent in certain populations, particularly in individuals of German descent. It's important to note that these are estimates, and actual prevalence may vary depending on the population being studied. The signs and symptoms of myotonic dystrophy can vary widely depending on the type and severity. The hallmark symptom is myotonia, which is a prolonged muscle contraction. This means it's difficult to relax your muscles after using them. People might have trouble releasing their grip, or difficulty relaxing their facial muscles after smiling. Other common symptoms include progressive muscle weakness and wasting, especially in the face, neck, and distal limbs like hands and feet. Beyond muscle issues, individuals can experience cataracts, heart problems like arrhythmias, excessive daytime sleepiness, cognitive impairment, gastrointestinal issues, and endocrine problems like diabetes or thyroid dysfunction. In men, testicular atrophy is also common. It's important to remember that not everyone will experience all of these symptoms, and the severity can vary greatly. Diagnosis of myotonic dystrophy typically starts with a physical examination and a review of the patient's medical history, including any family history of the disease. Electromyography, or EMG, can be used to confirm the presence of myotonia. However, the definitive diagnosis is made through genetic testing. A blood sample is taken and analyzed to determine the number of CTG or CCTG repeats in the DMPK or CMBP genes, respectively. This genetic testing can not only confirm the diagnosis but also help determine the type of myotonic dystrophy and potentially the severity of the condition. Myotonic dystrophy is primarily classified into two main types: myotonic dystrophy type 1, or DM1, and myotonic dystrophy type 2, or DM2. DM1 tends to be has an earlier onset than DM2. Within DM1, there are also further classifications based on the age of onset: congenital DM1, which is present at birth; childhood onset DM1, and adult onset DM1. Each of these subtypes presents with a slightly different spectrum of symptoms and severity. Unfortunately, there's currently no cure for myotonic dystrophy. Treatment focuses on managing the symptoms and improving the patient's quality of life. This often involves a multidisciplinary approach, including physical therapy to maintain muscle strength and function, occupational therapy to help with daily activities, speech therapy to address swallowing and speech difficulties, and cardiac monitoring to detect and manage any heart problems. Medications can be used to manage specific symptoms such as myotonia, pain, and sleep disturbances. Assistive devices like braces or walkers can also be helpful. It's really about addressing each individual's specific needs and challenges. Because myotonic dystrophy is a genetic disorder, there's no way to completely prevent it. However, genetic counseling is highly recommended for individuals with a family history of the disease. Genetic counseling can help families understand the risk of passing the condition on to their children and explore reproductive options such as preimplantation genetic diagnosis or prenatal testing. The prognosis for individuals with myotonic dystrophy varies greatly. Some individuals may experience a relatively mild course of the disease with slow progression, while others may experience more rapid and severe decline. The severity of the disease, the age of onset, and the presence of complications such as cardiac or respiratory problems all influence the overall prognosis. Recent research is focused on developing new therapies that target the underlying genetic defect. Antisense oligonucleotides, for instance, are being explored as a way to reduce the levels of toxic RNA produced by the expanded repeats. Gene therapy approaches are also being investigated. While these are still in the early stages of development, they offer hope for future treatments that could potentially slow or even halt the progression of this debilitating condition.